Good afternoon, and thank you for joining our webinar this afternoon. To give a brief introduction, I'm Shane from Space Store, and before we dive into today's topic, I wanted to give a bit of a background to Space Store Healthcare and where we've come from and the reason behind the webinar. So, as I mentioned, I'm Shane, a concept advisor here at Space Store Healthcare, so work with NHS clients and architects around healthcare developments. I'm joined with my colleague Alex Harvey, and today we're going to discuss around some of the insights we gained over the last year and the innovations for this year. To give a quick overview of who Space Store are, so we are the creators of architectural space-defining furniture that's a blend of California cool and London design. And we've learned from our long-term engagement with some of the world's most successful and global companies, the likes of Google, Pfizer, JP Morgan, how their workplaces drive their organizational goals, whether that's attracting staff back to the office or creating a space and adapting it for the hybrid way of working. And it's on this journey we developed some of our products which have then since become a need within healthcare environments, mainly around outpatient transformation and the increase in virtual consultancy and how staff need those right spaces to conduct those and also help in tackling the waiting list backlog around introducing virtual and blending that in with face to face so we can speed up efficiency of appointments. Alex, I don't know if you want to briefly introduce yourself and some of the work you've done with Space over the years.
That's great. Thanks, Shane. Thanks for having me, and thanks everyone who's joined. So my name, as Shane's mentioned, I'm Alex Harvey, VP of Sales here with Space Store. My role is largely focused with our clients in the US. So whilst you'll recognise my accent and I'm UK based, most of my time is spent with clients in the US. So that's a variety of corporate clients. So some of the large global organisations that Space Store are working closely with, the likes of Google, PwC, Pfizer, some of the most creative and innovative companies in the world who are creating world-leading and world-class workplaces to help them attract and retain talent, as well as healthcare organisations and education and other sectors. But the work that I do really helps me to understand what the clients are looking to achieve and how they want not just a workplace to look, but also how they want it to operate from a functional standpoint and the experience that they want to create for their employees, the visitors who enter the space, the contractors. And I see a lot of parallels between some of the kind of key drivers, the key settings, and when I say settings, I mean kind of types of space that are looking to create for people, whether that's individually working, whether that's collaborating, whether it's focusing, whatever it is people are trying to do. I see a lot of parallels between the types of settings that corporate clients are creating and some of the challenges and opportunities that we see working with the NHS and healthcare trusts here in the UK. So that's a brief intro, Shane. Thanks.
Good, thanks, Alex, and good to have you on today to share some of those insights. So today's topic was around looking back at some of the insight series we ran last year and picking out some of the, I guess, the main highlights that we found were going to help us in transforming healthcare over the next year. Some of those we can implement now, some are more future things we need to be working on to help us transform the delivery of healthcare. Before we just dive into some of those, I thought it'd be good just to recap some news from Space Store over the last month or so. So a big step for us more recently this year has been being awarded as a framework agreement supplier with NHS SBS. And what this has really enabled us to do is work more closely with our clients within the NHS and how we can provide better service. So in terms of what the framework covers, it's about a quick and simple, easy way for yourselves as trust to easily procure items. And as a trusted supplier with other NHS trusts, it makes it easy for you to look at other work we've done with trusts, and then you can replicate that across yours, making it a quick, simple, easy process. So a couple of benefits of using it just there you can see on the screen. And ultimately about what it is for us is about helping to support you streamline the process of procurement and how we can help you develop your work settings and processes so we can support with our product. Obviously gives you a catalogue of products you can choose from um, at competitive pricing and looking at options that other clients have already used in the NHS. Alex, I don't know if you have any comments on our work around that.
No, it's good. Thanks for sharing. Yeah, I think you covered it well, Shane. I think I guess from the NHS Trust perspective, it makes it easier for us to collaborate and to work together on projects. We've done some great work previously with the NHS and with various trusts nationally, right the way from Southampton to I'm not quite sure how far north we can go, but certainly the length and breadth of the UK at least. And that's been great. We've really enjoyed the projects we've done to date, but I think this helps to make that process quicker, easier, and smoother. So now that we're part of the NHS SBS platform, and I think what you've called out on the slides here is important. The Space Store's commitment around sustainability and the product certification we have around material transparency are a very important part of who we are as an organization and the value that we bring to the table. So as well as, beautiful looking, very functional pieces of furniture that do a great job if you're using them, and I'm sure the attendees will have noticed that both myself and Shane are modeling two different space products between us. But so as well as, great looking and very functional pieces of furniture, we have a real environmental commitment, which I think feeds very closely into some of the goals that the NHS has as an organisation around net zero and looking at your supply chain, looking at the carbon impact of the products and materials that you're using within your spaces. So that probably all I had to offer on that one, Shane.
Yeah, no, that's good, and it's good to mention, especially CSR in terms of becoming an agreed supplier. There is a lot of work and various things you have to meet to become a supplier, and obviously a strong part of that has been our CSR policies as well. So moving on quickly to what we've been launching over the past month. So for those who aren't aware of Space Store on our products, so one of our main products we've worked with trusts on is the use of single or multiple person pods for either video or phone call. We've been extending that across some of our other ranges, and we have a range called Portals, which is a family of booths about creating different work settings. So we've noticed across whether it's healthcare or education or workplace, the need to have those different areas you can work from, whether it is a open space for collaboration or focus spaces on your own or with other people. So I've been working on some other new products, and we've added we've since added the 2 and 4 person collaboration booth to our family, as you can see on the screen there. What we've got already is an open version and a single person quiet version. We've just launched the Portals Huddle, so a 2 or 4 person booth for hybrid video calls or just one-to-one conversations. And we've also got a few other pods in the making that will be launching soon to add to that range to provide for those different environments and settings we've been mentioning. And as you can see, it's just a bit more detail around the Portal Huddle and the environment it gives you. So a bench seat with a table and available in 2 or 4 person, plug and play. So you can just easily install that in your space just with one plug, and that is ready to go.
Probably just worth noting on that point, on the plug and play point, Shane, if I can just chime in.
Yeah.
This is effectively a furniture piece that provides you with all of the provisions, both acoustically and from an ergonomics perspective, provides you with all the provisions that a meeting room would offer. So we're seeing across a wide variety of sectors and client types that right now, in 2024, in the world in which we now live, where hybrid working has become the norm for many organizations, we're seeing that a meeting of between 2 and 4 people physically is probably the single most common type of workspace setting that many of our clients are asking us for. This will give you exactly that, but you don't have all of the disruption of you know, building a room, whether that's closing an area off because of contractors working and disruption to other staff, air conditioning changes, lighting changes, the whole kind of design and architectural development process. This is quite different in that this is a furniture piece that you could potentially add to an existing space over an evening or over a weekend or on a one-day install, but performs, both acoustically and, as I say, ergonomically. This is a great environment for people to have a one-to-one conversation, maybe a 2 or 3 person meeting, collaboration, and can be very simply added as a low disruption, plug and play furniture space that you can use for that meeting purpose.
Yeah, very good. And not with this actual particular product, but I've been working with Southampton more recently on a space where they do want essentially an interview room, but obviously haven't got space to develop it in any other way other than adding something in their waiting area or a lobby area. So the benefit of working with them is we can just implement this pod simply, quickly, and easily without any interruption, and it gives them that interview room, which otherwise would be a lengthy process and a lot of disruption. So I think something we are seeing again that is continuing to rise in terms of changing some of those spaces within existing estates, and probably brings me on nicely to our first point of the some of the insights we were going to discuss. So point number one was around optimizing estates and processes, and this covers various angles and different parts, but a couple of things here around there's one part around the estates and optimizing how we're using it and why we're using it and where, but also then the processes around how we're doing the care, which again leads into the estates, whether that's different locations or actual the process we're using. A few strategies that came up that we just been discussing with clients last year is around preventing unnecessary visits to hospitals. So whether that is using other areas, so whether health on the high street or more going to a virtual consultation. So there's a number of different angles around how do we reduce the actual visit, but then also prior to that, if we're streamlining patient pathways, how we can maybe reduce the amount of times a recurring appointment may be happening. And we'll dive a bit more into the actual patient experience point of this a bit later, but it's more around how we can streamline the process, optimize it so there's not unnecessary actions happening and we're focusing on people that actually need to be seen, and whether that may be seen face to face or virtual or on a space in the high street. Different locations can be used for different patients depending on what their needs are. A few other tools that have come up in terms of helping with this, so things like chatbots, and I guess AI is a massive topic, and it came up a lot and has come up a lot in discussion recently about how we use that. I think it's important to note that AI is a great tool and we should be embracing it and using it, but also it's not going to replace people's jobs, but it's actually going to enable them to do their jobs better. So it may need training, it may need development on how we're actually going to use that AI, and it may create different job roles. But it's about focusing on how AI can help all of us and channeling that in the right ways and measures to help us improve those patient pathways and increase the efficiencies. So things like chatbots. I think again it was Southampton we were chatting with. They've been trying to use chatbots just to essentially speed up their processes. Has a form online built into the chatbot, so a lot of questions can be answered without any human interaction. Just cutting out that admin time, which takes up a lot of all of our time. Admin is something that takes up a lot of time, and isn't always time well spent. And just helping to reduce those waiting times of patients, which again comes back to that whole patient experience factor about improving their experiences. A lot's come up about inclusivity as well in terms of catering for all needs, all languages, and removing any barriers within healthcare. And again, AI is a big tool that can help with that in terms of translations, those kind of things, and making sure we've got everything in place. So whoever we are speaking to, we can work with them, make sure they understand us and we understand them ultimately. Alex, any comments to chime in on this first driver?
Yeah, I guess probably bigger. I'm not so closely connected to the NHS trust conversations as you are, so appreciate your insights there. I guess the kind of bigger picture I'm seeing with a lot of clients is um, a focus on almost a kind of a two strand strategy where, as you say, people don't come to site unless they really need to, but when they do really need to, they get a really good experience. So it's kind of removing the unnecessary, removing the face-to-face interaction that could be done virtually or could be done digitally or could be done using some kind of chatbot or using AI to support and um, continue the conversation. But at the same time, when you do need to come to site, when you do need to visit the hospital physically, you get a really good streamlined experience. And I think maybe historically there's been across maybe many sectors, there's been an acceptance of a kind of a mediocre experience is the norm. But I believe that, as things evolve, as these technologies are embraced and kind of brought on stream, ultimately we'll get a better patient experience, and I think we'll get better value for money. My personal view is that we could actually reduce real estate footprint significantly across, if you looked at the entire footprint of the NHS England, and you could reduce your real estate footprint by 5-10%, and we've seen some clients have reduced their real estate by up to 50%. If you could just reduce by 5% or 10%, if you look at the cost and the running cost and the environmental impact of all of that, it's seriously significant. And I believe that there's a real opportunity for this to be a kind of pivot point. This stage we are right now could be the start of a new horizon, but it needs change. It needs a different approach. So probably going a little bit kind of off on a tangent there, Shane, but just a few thoughts.
Yeah, no, that's good. And I think we've seen that, and it's looking at how we are actually using that estate that we've got, and is actually that a good use of that estate, or could it be used better in a different way for something else? So, kind of, as we said, optimizing that estate to get the best form and function from that. I think, as you say, if we can move on to that change, the kind of step change that we need, then ultimately it's going to jump us forward for the future.
And sorry, just chime in with one other thought on that. And actually, just before I do that, please, any of our attendees, please feel free to jump into either the chat or the Q&A, whether you're on Teams or on the LinkedIn live stream. Please feel free to throw in your thoughts, your comments, whether you think that what we're talking about resonates with something that you're seeing right now, something that a challenge that you're facing and experiencing right now, or whether you've got some other views. Would love to hear from you around that. I was just thinking that the whole preventing unnecessary visits point, just to wrap up on this one, I think the other studies that have been done, which are pretty interesting and pretty significant, is the environmental impact of those visits. So you've got somebody jumping in a car, driving to a hospital site somewhere. The impact in terms of carbon emission and carbon footprint, I was looking at an interesting study, which I think it's Wolverhampton put together, is pretty significant. And again, I think there's an opportunity for us not just to reduce costs, and I know financial benefit is very, very important, especially right now in the NHS, but also to look at some of those bigger goals around environmental impact. That was all I had, Jane.
Very good. No, and that probably leads us nicely on to the second point was to focus on, which was diving a bit deeper into virtual. So a lot of our work with trusts has been around the outpatient transformation and looking at virtual consultancy. And it's been interesting working with a lot of different trusts with different strategies, how they've implemented that, and looking at again patient feedback on that process. And I think I was having a conversation this week with a clinician around how this has kind of changed again over the past year. So obviously, COVID accelerated the need for virtual consultancy, and everyone had to kind of change. It was a kind of enforced change, adapting to that new way of doing appointments. So what I was thinking was over the past year, maybe that's kind of dropped off, which in my conversations over the past week, this is exactly what had happened. So the kind of lessons learned from COVID have kind of almost been pushed to the back. And this clinician was saying that more recently there's a day when his car broke down. He couldn't actually get into hospital to do his face-to-face appointments for that day. Ended up changing them all to virtual, and this was for MSK. So after the day's work, he established that actually only one patient did he recommend that he should see them face to face. So out of all of those appointments, otherwise his day could be spent doing them virtually. And looking at that in terms of obviously he didn't have to travel in that day, but he could have fitted in other appointments if the virtual appointment was only 15 minutes as opposed to the 30 minutes you may allow for waiting time, etc. So I think what we've been working with trusts on how we re-implement that virtual consultancy. I know a lot of trusts had goals near the time around COVID, around maybe 20% being virtual calls, and it's looking at how we can work back towards that. There's a few points here. As with anything in terms of change, it does need to be managed, that change management, and we've got a lot of trust on how can we help them manage that change. If clinicians want to continue doing it face to face just because that's what they prefer, and that's kind of the norm that they're used to, how do we help them look at this virtual way of doing it? What are the benefits for them? And help them along that journey, I think, is key as well to make sure we're giving staff that support to do it. There's been a lot of maybe teething problems as trusts implement virtual in terms of bad connectivity, those kind of challenges. And it's kind of bundling those challenges up, overcoming them, and working from them, learning from those challenges to implement this as a success as we go forward. Because as we've been saying, helping to remove these unnecessary visits, virtual is a big part of that. And it may not be an actual video call, it may be a phone call, but doing the appointment in a way that it saves travel for the patient, so it saves their time. And as Alex has been saying, it saves a lot around sustainability in terms of, and then car parking and all sorts of elements that it affects. And this is not just about either the patient or the clinician, but it's everyone as a whole benefiting from it. And a challenge that often comes up with this is around either digital poverty, or maybe not everyone is enabled to join maybe a digital consultation. I think from the work we've done, that's actually maybe not exactly a myth, but it's not as big a problem as people make out. It is something that can be overcome, and a lot of elderly would have this access, and we've worked with trusts on looking at other alternative ways for helping those that haven't got that digital access to get that access, maybe be it at a local library where there is a video pod they can go and use and log in to that appointment. So when they're downtown getting their groceries, they can then tie that into their virtual appointment. Or as well, that ties obviously into health on the high street. But kind of looking at those different ways of just overall efficiency for everyone in their day-to-day lives as well, in terms of taking time out of work. A lot of elements move towards that, the benefits of doing virtual consultations. The case study on the screen is with Birmingham Community Healthcare. We did a lot of work with them on actually looking at the patient feedback from virtual consultancy, mainly around the time of COVID. But I think as an overall picture from the results we got from the Birmingham study was the fact that patients actually liked doing virtual, and around 80-90% were happy with it. Sometimes there's a few challenges, but there weren't challenges that couldn't be overcome. And I think from a clinician perspective and the patient, there was good experience all round. especially around having, from a clinician point of view, that environment to do the video call in successfully is an environment they could be on their own. They weren't distracted. It was set up for doing those video calls, and that they could do that easily without any trouble. Alex, I don't know if you have any comments on that. I know you did a bit of work with Birmingham originally as well.
Yeah, that's good, and I think it's good to kind of connect the dots between the products that Space Store are creating and kind of how it's helping trusts to meet the needs and the challenges that they're facing. So maybe a little bit of a plug on products wise. The enclosed booths that we were looking at the beginning, what we're seeing with a lot of trusts is they're saying we don't have enough spaces where an employee or a clinician can go and have a private call, a call where they can either speak to a patient. Sometimes it's taking internal calls, more kind of admin type calls, but we don't have enough spaces where people can go to take a virtual call, whether that's video or phone, which brings a number of challenges, both around patient dignity and confidentiality of patient information. It also brings challenges with if you're taking that video call in an open plan space, there are probably 5, 10, maybe 15 people in earshot, and is there a potential loss of concentration and distraction as a result of the person taking the video call nearby? I think we've all been in the open plan space with that guy who talks too loudly and you kind of can't get on with your work. And there's a lot of studies around productivity and the impact of distraction, of loss of focus, and ultimately on productivity. So I think there are some real, maybe more intangible, but very significant challenges and benefits that these products help to solve. And to your point, Shane, I think having the patient at the center of this conversation is really important. I know personally, if I had to have some kind of medical consultation or virtual consultation, I would much rather, unless I absolutely had to, I'd much rather make that virtual. We're talking spending half a day away from work, taking time off, arranging childcare, traveling to the hospital. It's a kind of an unfamiliar environment, kind of all the things that we probably hear all day, every day from our patients. As I say, if we could get to the point where you visit a hospital site only when you need to, not just by default because you have some kind of medical appointment or consultation, I think it would be a better patient experience, and I think it would give the trusts themselves an opportunity to streamline and improve and ultimately save cost as well, which would enable, it would free up funding to enable a better experience all around.
Yeah, that's good and leads us nicely onto our next point, which we've probably covered a fair bit on. But as you say, it's going back to the focus in terms of the end of the day, the patient's kind of a bit like our customer, and we've got to serve their needs and make sure we're looking after them in the best way. So as we've mentioned, this transformation lies at the patient being that center and understanding their needs. I think it's understanding that these needs may change over time, and demographics. We need to make sure we're continuing to evolve as well and deliver that high quality care that patients want. And to Alex's point, I'm not sure exactly why, but my wife sort of hates hospital environments and doesn't like going, in terms of wouldn't like to go to an appointment. So kind of the next best thing is a virtual appointment. So unless they're offering that, it's not an option for her. She has to go to that environment, which maybe she's not liking. So creating these environments, that people actually want to go and visit when they need to, also providing options for the clients. And the clinician I was talking to earlier in this week was saying that sometimes it may come through that the patient actually wants to do a call virtually, but the clinician is actually choosing and enforcing it to do it face to face, just because that's what they prefer. I think it's important to make sure that we are looking at what is the patient preference for the consultation, and making sure we are doing it to their way. So one particular point, which, as I mentioned with Birmingham, they did is actually getting that patient feedback, making sure we are speaking to patients, doing surveys. What are their views? I mean, do we know actually what they think of our current process for consultations in terms of from booking it to aftercare, the whole process? What are their thoughts and feelings? Is it a good experience? Is it a bad experience? And then we can collate all those and look at where can we improve, what do we need to change. So I think that's a really important factor. I know a lot of the trusts we've worked with have been working on that in terms of how can we improve that experience. Um, and ourselves, we like to do that as well in terms of from a product point of view. So with the products we implement across NHS trusts, we have a QR code in there so they can scan that and send us feedback. So from clinicians that are doing calls in our product, we can get real-time feedback in terms of how they're actually finding that experience. Um, so it helps us in terms of continuing that product development and making sure we're covering the environments that the clinician wants as well. Anything do you want to add, I think, to the patient experience point, Alex?
The only thought I had, and I think it might have been on one of your earlier slides, Shane, was the whole equity of access, providing equity of access for both staff users of spaces, as well as patient equity of access and equity of access to services. I think is a very important element of where virtual particularly can add value and create wider channels or access to more channels, perhaps. From a perspective of the user, if we look at the user as the clinician and some of the pods that we've been talking about, we've done a lot of experimentation here at Space Store, working with some of our global clients. Particularly Google was one where we did a lot of work with them, understanding the video experience that a user with white skin versus, say, somebody with black skin would get in different types of environment, when we experimented with lighting, with material colors of backdrops and that kind of thing. So we've tried to create the most equitable video booth so that you've got a platform where any user, no matter what their skin color or skin tone is, will get a brilliant, an equivalent and an equitable video experience, and the ability to kind of create an environment where, you're ultimately the feedback and visual cues that you're bringing to that discussion, whether it's a kind of clinical discussion or a meeting of some sort internally. Back in the old days when we used to meet face to face, we had body language, we had visual cues, we had feedback that would help us to understand maybe the things that the other person wasn't saying, maybe understanding a bit more about their thoughts and feelings that maybe they weren't putting into words. And we don't want to lose that, and we can't afford to lose that. And particularly in some of these clinical interactions, it's really important that we don't lose those kind of visual cues. So the ability to kind of have a really clear digital, very visible digital version of whoever it is into that meeting, and able to kind of see their facial expressions, see the visual cues that they're bringing.
Yeah, very good. That's helpful. Thank you. Staff well-being has been obviously a big topic more recently as well, in terms of topics from mental health to other topics. But I think ultimately, and kind of is what's in our DNA at Space Store from whoever our client is, in terms of our product is around focusing on staff well-being in terms of creating those spaces that staff actually want to come and use, making sure they're a space that's designed for the use case, whether it's a pod for a whole clinical session of up to 5 hours, or is it more of a pod that's designed for a quick 10-minute phone call? Those kind of different environments are actually have different ergonomics, and it's about designing the product to suit how the pod is being used. And I think that spans more across the whole sector in terms of what we're focusing on to make sure we're catering for staff well-being. And probably something that's not been such a big focus within the NHS trusts as maybe some of our more corporate clients over the years. But ultimately, if we are improving our staff well-being, then that is going to then improve productivity and improve service, and then that patient experience is going to improve as well. So it's all kind of a flywheel to work on. And a few just points that we think would help in terms of strategies, in terms of helping improve that staff well-being. And again, it comes back to the kind of change management in terms of how we're going to help them on process if we need these changes. So providing adequate support in terms of resources that they need. So especially if you are transforming to a new platform, any changes like that, you need to make sure that you've got someone who that an employee can go to and say, I have a question about this. Make sure there's onboarding processes, help and support they can tap into to help them use that. Because ultimately, a bit like virtual that may have tailed off a bit. If we look back at the whys, it's maybe because we haven't focused on that change management and given staff the support they need and maybe the tools they need to actually do that. Also focusing on the fact that obviously staff burnout has been a big topic over the past year, and a part of that is again providing those spaces. So whether they need to have a private space to take that private phone call, whether they need to have those individual spaces to focus on work, whether it's a collaboration booth or space where they can have a one-to-one conversation with one of their peers that needs to be private around a particular case. Having those different environments that staff can use and making sure it's a comfortable space, and then making sure that we're not driving performance over that work-life balance. So making sure that staff are taking that time out um, for a break and spreading the workload needs to be a big focus. As I mentioned, those different work areas, and we've worked a lot on that in terms of the different spaces that you need for the different tools. Some of the work we've done, it may be a pod designed for a video call, or it may just be a private space that staff need to focus on that admin work for an hour without being disturbed by others in the team. And if they've got that small room they can go into and focus on that, and everyone else knows they're focusing on that work, it helps them get that done. So overall, something we need to focus on. So we're improving our staff wellbeing, which will then help them improve their service, make them happier, which will then improve the patient experience at the other end as well. Alex, any insights to share around the patient and the staff wellbeing?
I think you've covered it very well, Shane, and it's kind of, if you like, it's where everything starts. You know, the sharp end is really the people. It's the people who are delivering the services. In this case, clearly, the patient support and everything that happens. But it's the people, and I think when they feel supported, when they're in a positive place from a well-being perspective, they're going to be able to do the best job. They'll be able to do their best work, and providing, as you say, some of that support and maybe firstly understanding. And I think in the last few years there's been a much greater understanding of the importance of well-being and what we need to do to make sure that everyone is feeling supported, make sure that staff are feeling supported, and maybe have space to be able to, you know, when pressure's mounting up, they have space to be able to take some time out, and it's okay. It's fine to do that. So it's kind of almost getting back to basics, but I think getting that foundation right, getting back to basics, and getting the staff well-being on a strong footing will also give us a real foundation to extend and improve when we're looking to patient experience and the whole patient journey. So yeah, that's a few thoughts I had on that, Shane.
Yeah, no, that's good and helpful. Jumping on to our last driver, we're focusing on and more focused on around maybe the estates, but looking at adaptability and flexibility of space. And this can be in various forms again, in terms of whether that's down to different sites, having smaller satellite sites, or actually just internally within the space being able to change that around. And I think there's been some interesting case studies over the last couple of years on trusts that have actually created these flexible spaces so they can change their space around. So depending on the needs of the space at that moment in terms of what is busy, what do we need more resource for. From our point of view at Space Store, this has come around a lot in terms of the adaptability of the estate. So obviously, a lot of our product is around having that modular solution, which is plug and play and can be introduced without disturbing existing estates. But also in terms of new projects or spaces that trusts are building, having that ability to, as the needs change over time, being able to change that space again without that disruption. And I mentioned this slightly before, but around the changing patient demographics, how things change, and what may have worked once won't always work forever. So we need to look at what are the needs we need to solve, and do we actually need to change our space to adapt to that? And I think obviously digital transformation is a big part of that. The traditional space that we may have designed 10 years ago within healthcare is very different to the space we're designing right now in terms of smart hospitals, those kind of environments. So focusing on maybe a hospital that we designed 10 years ago, if we had a vision for that to be maybe a 30 or 40-year kind of build that would last for, actually, it may not be that long anymore. The space we design may only last for 3 to 5 years in terms of then we've got to change it around. It's building in that future flexibility within the space so we can change that to suit the new needs that come up. Obviously, a focus on that as well, and Alex has touched on net zero targets within the NHS, but around obviously the sustainability part of that adaptability and flexibility of space, if we can change it without creating more waste and we can reuse stuff. And we've been looking a lot in terms of product life cycles with our products and having clients that want to actually purchase furniture that's been pre-loved and used somewhere else. So having that whole life cycle of product as it is used, and it may not stay in the same space forever, and it may move on, and another trust may use that particular product. But it's about focusing on having that future flexibility for when and you need it. And something that's come up probably more with talking with architects over the past year in terms of around less is more. Um, what do we actually need within that space, and making sure that the space is designed for a use case, but it may not be just one use case, and look at it in terms of can this space serve multiple functions, maybe just by changing a few things, or actually in the space that you design. Um, as I said, future flexibility is really the nature here, looking forward to what we want to create in the future as well.
Yeah, it
Alex,
seems to
any
be a
insights on
very
that?
strong trend we're seeing with multiple industry sectors is having flexibility baked into the design of the space so that you can adjust, change, adapt, reconfigure to a greater or lesser degree over the life of that workspace or of that environment. So that might be small changes that the users can make in terms of tweaking furniture and changing stuff that they're using today. Might be something very simple like that, or it might be, as we were talking earlier, a kind of a reconfigurable furniture system which enables you to completely reshape the boundaries of the space and the way that space is divided up. And there's a real spectrum in terms of how much what degree of flexibility is needed. But I think what's clear to me is that with many clients, flexibility per se is kind of a must-have now in many spaces, and the ability to reshape that space, but as you've already touched on, Shane, without knocking down a load of drywall partitions which then have to go to landfill, which in itself is also hugely disruptive in terms of you've got to close the space down because of dust, because of noise, because of construction work. So flexibility is a great point to touch on. Yeah, I think that's probably all I've got on that one. Just conscious of time. I think we're running a minute or two over, so I guess we'll keep moving.
Yeah, and that's good. And I think that bring us to the end. So thank you for that roundup. Don't think there's any other questions that have come in. So unless anyone has any questions right now at the end, I'd like to say thank you very much for joining either via Teams or LinkedIn. And if you have any questions after, then feel free to get in touch. I'm more than happy to pick up on any conversations around further insights or product opportunities. So thanks, Alex, for joining, and good afternoon.
Good. Thanks, Shane. Enjoy the conversation. Thanks, everyone, for joining.